Welcome back to the Caregivers Journal podcast. I'm your co-host, Lance A. Slatton. I have the esteemed privilege of welcoming our other co-hosts, Cindy and Christina Hardin-Weiss, founders of Adaptive Equipment Caregiver Corner. Welcome, ladies.
Hi, Lance.
Hi, Lance. How you doing?
Good to see you again.
Wonderful. Always good to see you guys and start off the new year seeing you. What more can I ask for? And today we're joined by Vicky Castillo. She is a family caregiver, a registered nurse, and the owner of FACETS Healthcare Training. Welcome, Vicky. How are you?
Thank you. Thank you. I'm doing great this morning. Greetings from Phoenix, Arizona.
Okay. All right. I'm going to hold that against you because welcome from cold, frigid Michigan.
That's
right.
we pay for it though in the summertime,
Yes, you do.
124 degrees. So this
Yeah.
is our compensation for what we have to go through in the summer.
Yes, I totally relate. I have family that live in Lake Havasu, so I can understand that. Vicky, first, again, welcome to the Caregivers Journal. We're sharing stories with real caregivers, and I introduced you as a registered nurse, the owner of FACETS Healthcare Training. But the first thing is you're a family caregiver. Why don't you share with us and our viewers and listeners how and when you became a family caregiver?
Sure. Well, I think it was what I was born to do. And I've been a nurse for almost 38 years. This year will be 38 years. But in addition to that, and equally important, I have cared for multiple family members. As a nurse, you seem to be the go-to person for I have a scrape on my knee, or there's something in my eye, or what does this look like? I think most nurses can relate to that, or people in healthcare can relate to that, right, Cindy and Christina?
Yes.
And but the more formal role was when I was caring for my mother, who died a few years ago. She was 88 years old when she died. She was on hospice. I'd worked hospice for many years, so I had quite a bit of knowledge to care for her. And I was so blessed to have been able to be with her when she passed away. And it was during COVID. So I made it an absolute mission for her not to go into a facility or a hospital. I wanted to manage her care at home because we wanted to be with her when she passed. And I had that the blessing to be able to be with her when she passed away. And it was a very peaceful death. And I hold that very dear to me that I was able to be there for her. And then after my mom passed away, I became the caregiver for my special needs sister, who's 72 years old. She was living with my mom, and my mom was her caregiver, but not much of a caregiver towards my mom's end. So there was a lot of that we had to do to shore up my mom's care and then my sister's care. So my sister came to live with me. I have been taking care of her, and recently my sister has gone into assisted living because there's been some changes in my life, and she has declined as well. So she's gone into assisted living and she's very happy there. And it was a difficult decision to make. I certainly can understand caregivers who struggle with that decision, but it's something that we really have to consider try to put the emotion out of it as much as possible. And when I used to lecture as a nursing assistant instructor about caregiver strain and how that's a very real thing, it's easy to stand up there on the podium and lecture about it. But once you do it, it's a totally different thing. And so I often tell myself, or I tell my close friends, I've shared this with Cindy and Christina, that I think I can write a book about it, and I'd like to maybe consider that someday about caregiver, being a caregiver, and hopefully my experiences will benefit others. So thank you for allowing me to share my story.
Oh, absolutely. And that's why we do the show, is to let other caregivers hear from real caregivers. It's one thing if you were here as a quote unquote registered nurse or as an instructor telling people, but never having gone through it. But because you have gone through it, I think you're able to be more effective and relatable because you experience a lot of what these other family caregivers have experienced, which I think is very, very helpful. Every caregiver faces a different journey, different circumstances, different dynamics. But at the end of the day, we're all identified as a family caregiver. I was a family caregiver for my father. I had different challenges and different things that I faced because I was in my early 20s. I was in my thralls of pursuing medical school, my life entirely changed because of that experience. There's different challenges. Not all challenges mean it's a bad thing or a negative thing. It's just things you have to work through, things you don't expect or plan for, especially like becoming a family caregiver. What were some of the biggest challenges that you faced in your caregiving role?
I'll just narrow it down to, I'd say, three. The first one was navigating the healthcare industry. It is a maze. It is complex. It is disjointed, and it's not always to benefit the patient.
Yeah.
And so that's number one. And so I had that experience as a nurse, and I've worked many fields of nursing to be able to navigate the complex healthcare space. That's number one. The second thing I'd say is a takeaway is you have to advocate for yourself, and you have to advocate for your caregiver, and you have to, or the care person, the patient, the care recipient, and you have to finally make that decision for yourself. Just because a doctor, a nurse, someone else recommends something doesn't mean that you are obligated to do it. You have to critically think for yourself and say, is this the best decision? Is this a good advice? Is this going to work for me? And then there's consequences to choices. Does this choice work for me? What are the consequences? What are the benefits? Does this choice not work for me? What are the consequences and the benefits? So I was able to discern that information and make it work for us. I didn't just say, well, the doctor said this, so I have to do it, or the nurse said this and I have to do it, or the social worker said this, so I have to do it. You have to think for yourself. And then the third thing I would say is the emotional strain of it is very, can take a toll on a person, and you have to find resources to take some of that strain off of you. And it's different resources for different individuals.
Right. And I like really, especially when you said, you need to critically think for yourself. Just because somebody with a white coat or somebody at the hospital says this is what you need to do, that may not necessarily be what your situation needs. And I think also giving yourself permission to question those instructions or question that, prescription or whatever the case may be. Because oftentimes I feel like, I worked in cardiac critical care, Vicky. You go in, you see a patient, it's really a patient. It's not the person. You're not seeing all the dynamics, their social, status, their environment at home, what support they have, if any, and just dig a little bit deeper. And if you have information that could be helpful for the healthcare professionals, or they're recommending something and you aren't quite sure that's right, give yourself permission to speak up. You're not being disrespectful. You're not being, whatever the case may be. You're being an advocate, and an advocate is there to get information and make sure the right choices and information is being given. But, that's some of the more difficult, challenging aspects. But on the other hand, what are some of the most rewarding moments you've experienced as a caregiver for your mom, or, now for your sister?
Well, one of the more rewarding things I would say is meeting some very special people, caregivers, care providers, professional healthcare individuals, the doctors, the nurses. At the same time, you can't just say that, be judgmental. You have to say, hey, they're coming at from this perspective, but they really mean well. And so I've met some pretty spectacular individuals in the healthcare field. And then the reward of abiding by someone's wishes as well. My mom did not want to go into the hospital, and I was able to make that happen for her. I also is knowing that I did the right thing. To give you one quick example, at my mom at 88 years old, she had extensive lung condition from smoking many years, and she was quite emaciated, getting towards end of life. They recommended doing heart surgery on her. And she had gone through a lot of the tests. She was already suffering from dementia, and I just couldn't agree to that. And as a result of that, she did live probably a year and a half longer because I said, I don't agree with that. And she finally said, yeah, I think you're right, Vicky. I don't think I should go through open heart surgery. And my family did as well. So be able to stand up to that. Um, and then just the being able to share my experiences with others who are having equally are in a similar situation or have been. I think those are some of the rewards for me.
That's wonderful. You know, before I go to this next question, Vicky, I just want to follow back up on some of the challenges because you're probably the exception. Cindy and Christina and myself are the exception. But most family caregivers, I think, as a majority, are not healthcare professionals or healthcare educated in whatever aspect. You're a nurse and you're having these challenges. So what advice would you give to the lay person who, you know, maybe they were a bank teller and now they're taking care of their husband who, you know, has Alzheimer's and they're going into this healthcare complex, right? And they're trying to figure out, how do I navigate this? How do I speak up? And they don't, you know, get intimidated, you know, the white coat syndrome. Well, the doctor said this, so it must be the way it is. You know, we have families that we serve with our company, and it's so true. You know, they'll go in and the doctor will say, "Oh no, we think your dad's fine to keep driving, even though dad's gotten lost 3 times and, you know, ran out of gas one time." You know, but the doctor's not getting below that layer, right? Because he's not getting that information from the dad or from their mom. So he's only able to make a decision based on the information he's been given. How do you advise families who aren't comfortable and aren't familiar or have any background in the healthcare industry to really advocate and give themselves permission to question these people or to speak up?
That's a really great question, and we've seen that so many times. Families members that are so lost, and they have taken so many detours, and they're still so lost. And I would say to do research, seek support, seek information, and find individuals that can support your decisions and can align with your philosophy of how to move forward with situations. And there's a lot of resources out there. I know that there's like palliative care resources out there that support, you know, just conservative measures rather than aggressive treatment. There is medical social workers that are going to be very helpful. And also speaking up to the healthcare professionals saying, this is really what they wanted. This is in their advanced directives. This is what we agreed upon, and this is how I want to move forward. I appreciate that you are offering these other options, but that's not the way I want to go. And I think once you take a firm stance and also maybe have those advanced directives, I think that really helps for the medical professionals to, okay, you know, we're not going to push this person too much further anymore. They've seen their options and they're not going to go there. They want this path. So seek resources, seek individuals that will support your decision, and then stand by those decisions to the best of your ability. And then tell the healthcare professionals that this has already been discussed with the care recipient, and we have documentation in place. My mom had documentation in place as well. She had an advanced directive and the pre-hospital medical care directive in place and whatnot.
And that's so important. We always advocate for people, get your documentation in order because it can happen at any time and it just prevents a lot of heartache and, you know, conflict and difficulties knowing what your loved one's wishes are and having somebody that can advocate for those wishes. Before we turn it over to Cindy and Christina, I just got one final question for you right now. And I like these questions because a lot of times people think, and sometimes they wouldn't change anything or they have a big, you know, regret or whatever the case may be. When you stop and maybe you're just reminiscing or thinking back, is there anything you wish you would have done differently or that you wish you knew when you first started on this caregiving journey, starting with your mom?
I would say wish that I would have advised her to save more money when she was able to, because it became, as she progressed in her condition, I had to hire more help and I had to step in more often. And caregivers are very expensive. It's
Yeah.
expensive care. And so I wish that she did have the funds, but as we all do, we spend on stuff that we shouldn't be spending on. But it became a strain for her financially towards the end. But we were able to make it happen. But probably if she had lived much longer, it would have really probably been worse for us financially. So I'd say that to take care of the financial aspect of it sooner.
And really quickly, because your answer prompted this quick question, then we'll go to the ladies. Was anything from your experience being a caregiver for your mom? Are you implementing anything you learned through that experience with your sister?
Uh, yes, I would say yes. Yes, I would say so. That was the other part also, is that my mom, if she would have had some more forethought, would have left a nest egg for my sister. And so that didn't happen. So I had to step in to assist with that as well. Um, so just better financials, I'd say, financial planning. Yeah, and the other thing also, Lance, I think that was really helpful to us is that, and this was from my experience as a nurse, as a hospice nurse, but having final arrangements in place. When my mom passed away, it was so helpful that she had all her funeral arrangements already made. She had her cemetery plot already paid for, and for my sister as well, because I had spoken to her years earlier and said, "Hey, mom, let's talk about this." It was not an easy conversations, never is. But as a result of that, when my mom passed away, there was really nothing that needed to be paid for. And as we all know, funerals can be very, very expensive. But it turned out not to be the case, and we didn't have to put up any money for that to happen. And she also did that for my sister, so she did a dual plan for my sister. So when my sister passes away, there's no expense that's going to fall upon us as well. So again, it's a part of the financial planning of it.
Absolutely. Well, Vicky, thank you so much again for being here and sharing your story. I'm going to turn it over to Cindy and Christina.
Thanks, Lance. Thank you. Vicky, I find your story fascinating because you are a nurse and a family caregiver. Mm-hmm. And they are both very high burnout jobs, And so what I want to know is how, because I'm sure when you were caring for your mom and caring for your sister, you were still working. So how do you handle your own well-being when you're a caregiver? I mean, there's such a high burnout in nursing because that's what you're doing, and then also caregivers, it sneaks up on them as well. How do you handle your own well-being as a caregiver?
Well, I neglected it for about a year and a half. I have to be on, and I think we all do. We neglected it quite a bit. But then I realized that I couldn't continue neglecting it. So I remembered what some of the things were, kept in mind some of the things that I really enjoy. I enjoy going to the gym. I enjoyed simple walks. And so that was really helpful. And then also I recognized that I couldn't do it, all of it. It was just too much. So I had to hire and find individuals to come in and shore up what I thought I could do all on my own. I said, no, I can't, because I'm not going to be around here for 6 months doing this if I continue at this pace. So just really have to do a reflection. And some people won't, I know that they won't do that. They're just like, I'm just going to plow ahead. And then they're just totally burned out and they can't move any further. And that's the point where I did not want to get to. So we hired caregivers. We had, caregivers that would come in for a few hours so my husband and I could get out. That's the other thing is, I have a spouse and you have to have a relationship with them too. And that takes time. So I couldn't just devote all my time just to my mom and my sister. I had to also keep in mind my relationship had to stay healthy with my husband as well. So, and then just finding breaks, even small breaks to just get out on my own, even if that meant, okay, my husband's going to watch my sister for a few hours while I go to Walmart and I just go there for 2 hours. Even that little bit, just getting away helps.
Yeah.
Trying to prevent yourself as a caregiver from getting to point break where you almost can't pick yourself up from that point.
Yeah. So Vicky, just to ask you a question that's kind of off topic. You mentioned it though. You said that you had neglected your well-being for the first year and a half. Is there something that you can share with our audience? What does that look like when you hit that point and you go, wait a minute, I need to start caring for myself? Is there something physical? Is there something mental? What clicked for you to make you go, oh, I need to start taking care of myself?
That's really a great question. There is, and a lot of people don't want to talk about that, the emotions that they feel, and it is a group of emotions. It is frustration.
Mm-hmm.
It's a frustration because you're constantly doing something for someone else. You're constantly helping them with the shower, helping them get dressed, or helping them, get their supplies, making sure that they have toothpaste, helping them in the shower. I mean, it's constantly your life almost belongs to someone else. And so it's that you feel frustrated, you can get agitated, irritable, and then you just don't appreciate the relationship so much anymore. I found now that my sister that is in assisted living. When I go visit with her, I enjoy her presence now again.
Yeah.
I sit there and talk with her and we just converse, and it's not like before where we hardly didn't talk. And I just said, I have a few minutes. I'm just going to go in my room, or I'm going to go in my office and close the door. So I appreciate our relationship more than I used to before. And then I couldn't sleep in. I had to be up early because I had to prepare for breakfast, or with my mom, I had to be over there early in the morning to get her up and get her cleaned up and get her out of bed and get her in the wheelchair. So I wasn't able to sleep in. So my sleep lacked as well. And just that, I just have to be honest about this, just the almost resentment of feeling like my life wasn't mine anymore.
Yep.
Mm-hmm.
That resentment. And a lot of people don't want to talk about that, but I want to be sure that what I'm sharing, people recognize that this they're not the only ones that feel this. Many caregivers feel this.
Right.
Yeah.
Right.
You'd mentioned that when you put your sister in the assisted living facility, that you could go and visit her and your relationship blossomed a little bit more because you weren't her caregiver. Did you see anything like that? Any kind of, when you were caring for your mom, did your relationship with her change at all? Or was there, did it change and then you figured it out and then you made it better?
No, I think for my mom, I've always kind of been the daughter and the nurse. And when I just moved her from the bed to the wheelchair, I just did it as a nurse, and it was very mechanical and she needed it done. And my mom was tough. She had 9 kids, and the first 5, she had them at home, delivered them at home. And I think just with the midwife or not with anybody by herself. So she's just a tough person. It's that generation. She was that generation of just tough individuals. So
yeah. Yeah. Can you, again, your story is so interesting to me because you cared for your mom and then you cared for your sister. Can you, as a caregiver, can you juxtapose your feelings or how you were as a caregiver between caring for one and then caring for the other, one as your mother and one as your sister? Or if
it
there
was just a continuation, Christina. It was just a continuation. It was my mom passed away taking care of her, and then my sister came to live with me, and it just was a continuation. So, but your sister is your sister, but your mom is your mom. So there's different feelings there. Yeah, different feelings. My sister is more an informal relationship, whereas my mom was a more formal relationship.
Oh, okay.
But I still did all the personal care, the peri care, and the changing briefs and all that. So
Yeah. And you touched on this again, Vicky, but I think it bears repeating. Can you tell us some of the things that you did to make sure that the person you cared for felt heard and respected? You kind of touched on that with the healthcare, but for you as the caregiver, what are some things that you did to make sure that your care recipient felt heard and respected?
that's that is also a really important point because I think we assume as caregivers that we know what the person wants and needs. And too often we don't ask the questions and we don't wait for an answer.
Right.
We don't wait for an answer. So I would have to, my other family members, especially because there's 2 girls and 7 boys, 9 kids. And my brothers would just kind of just go in there and just like wolves in a china shop. I said, wait a minute, let's ask Mom. Let's ask her. She was still able to make decisions even till the end. I said, Mom, what do you think of this or that? And she would tell us. I'm like, okay, this is what she wants. This is what we're going to do. But have the patience to wait for an answer and the willingness to ask the questions. And my sister, who is mentally retarded, for her, it's even more of a challenge because she doesn't process very well. And she's even with her mental retardation now, she's having dementia is progressing. But again, asking her the questions and then waiting for an answer. And sometimes the answer can be kind of long for her. And then with her, my sister, is limit choices. I mean, I wouldn't ask her, do you want 8 things to eat? You have to limit. And again, that's all my experiences as a nurse and working so much with the geriatric profession. I mean, with the geriatric population. So limit choices, give options, wait for the answer, and just give that the approach of patience and compassion. Just wait and let's just see how it goes rather than trying to be always in a rush because there's so much to do. It's easy to get into that rush.
Absolutely. Yeah. When you were caregiving, especially for your mom, well, both for your mom and your sister, you were working. Is there any advice that and that's not uncommon, with the sandwich generation, you've got somebody caring for their young children, somebody caring for the parents, they're still of a working age. Is there some piece of advice or some advice that you could give to those people that are still working, but have family members to care for?
I was lucky enough because I own my business and it started doing well for me towards as my mom started to decline. So I had more time while I was working at home doing my own business that I was able to have a flexible schedule. But not everybody has that, and it's even much more challenging if you have an 8 to 5 job and you have to still take care of the individual or oversee their care. Once again, get help. Get help and stay in communication with those care providers as well, and have a schedule. If you work 9 to 5 Monday through Friday, Saturdays for a few hours going over there maybe, or a Sunday, and staying in contact with the caregivers that do go there. That was a situation with my husband's grandmother in Michigan. They had a caregiver that would be there 5 hours a day, Monday through Friday, and then my sister-in-law would go there every Saturday to check up on grandma. So in different schedules, and have other family members who are trusted family members help you. Accept the help. They are blessed by helping as well. And I don't mean blessed in a religious sense, if that, this is not a religious statement, but I mean, there are rewards to helping out as well. So allow people to help you out. Allow them. So when my brothers wanted to take my sister and have her over for a few days, I said, absolutely. Absolutely. She'd love to go. So
great. That's great advice. Cindy?
Yeah. Vicky, speaking of family, I'm glad that you mentioned that because a lot of caregivers when they start taking on these roles, they do feel like I've got to do it. I'm the only one that can do it. They don't want to ask for help. Do you have any advice when you start? Every family dynamic is so different. And any advice when you start involving other family members? There's going to be some that may be really involved. There's going to be some that aren't really involved. But how to kind of navigate who's going to do what, and how you handle that between the family members so that no one really feels like they're being dumped on per se.
Well, somebody is going to have to take the lead role.
Yeah.
Yeah.
Because that individual is going to be the one that communicates with the doctor, does the doctor appointments, gives the list of the medications to the doctor. How are they responding to the medications? Are there any changes? So somebody is going to have to take the lead role. No doubt about that. And it lessens confusion also with coordinating the care if there is a person with the lead role, in my opinion. But outside of that, I would say ask for help as well. Sometimes I would contact my brothers. I'd say, hey, I have XYZ going on. I have to go to a conference. I have this. Could you take her? Yeah, I can take her. But if they didn't know, and they're not going to, usually didn't volunteer, then they weren't going to do it. And so there's enough family members in my circle that we could do 2 days here, 2 days with so-and-so, a day with so-and-so, and it got a little dicey sometimes because they are who they are, but we made it work as best as we could. Yeah.
Yeah, I think that's a good advice. I think a lot of times people just assume that they know what people are going to say. They're going to be too busy. They're not going to want to do it. Yeah, but the asking for help and trying to involve everybody, but definitely having someone in charge and kind of having that schedule to help everybody out is certainly important. In your caregiving, and I'm saying this because, of course, we're professional caregivers, and it is nothing like being a personal caregiver at all. We've had moments with our parents that we've had to step in and do that, but it's not ongoing. But, as a professional caregiver, I love what I do, and I find a lot of moments of joy, but it's hard. I want to know from you as a personal caregiver, how have you had those moments of joy, even though the job is extremely hard and it's been 24/7 for you for a long time at points. How do you find those moments of joy, or have you had those that have really made an impression on you?
Oh yeah, many. First of all, it's really who I am as a caregiver. I mean, like I was mentioning to Lance, I think I was born to do this. So that's number one. And then saying that I did it is very rewarding for me too. It was hard, but I did it. And those are the moments in our lives that create resilience.
Right.
Give us resilience. And we use that strength to apply to so many other aspects in our life. And then the rewards of having taken care of my mother, and especially for some cultures, I'm Hispanic, and we generally don't put our loved ones in facilities. And that was very important to my family. They never even considered it. They figured I was just going to work myself to bare bones. Put my mom in a facility. So they just figured that, Vicky will take care of her. She's not going to a facility, but so easy to say. But the mechanics and putting that into practice is a totally different thing. So the fact that I did do that, and as I mentioned before, the fact that I was there at the very end, I had provided that ability for so many of my hospice patients and families that their loved ones were there at the bedside, that when it came to my time, I was able to have that blessing as well. And then my mom asked me to take care of my sister, so I was able to do that.
Yeah, that's very nice. Very nice. Vicky, as caregivers, a lot of times, and I know you spoke on this just a little bit, as far as trying to do things for yourself, to get those little moments of time away and things like that. We always stress it's very important the caregivers try to maintain their own identity. And I like the fact that you said that since your sister has been in an assisted living facility, now you can kind of go and talk to her more as your sister, rather than you caring for her and you her caregiver and your care recipient. Tell us a little bit about kind of how you try to keep and maintain your own identity and not just the identity of caregiver for your mom and your sister.
I think that's probably my personality, mature enough now that I have my own identity, and recognizing when I knew I needed help out more than what I was able to give her, and that that if I continued, I was going to just be completely burned out and I had to make a change. So, and that comes with maturity, life experience.
Yeah, that is.
I don't know if I answered your question, but
no, that's fine. That's perfect. And it can be a difficult situation. And I think, like you had mentioned, that's one of the most important things in trying to maintain yourself and your identity, is trying to take that time away, trying to get that respite help, trying to get, other people involved so that you are not the caregiver full time every day, day in and day out. Vicky, your experience as a caregiver and as a nurse is just absolutely wonderful. We appreciate, you being here and sharing that with people, because I think it's very, very valuable. Lance, we're going to throw it back over to you.
Vicky, I just wanted to follow up on, one of the things you said with, the difference between caring for your mom and, caring for your sister. Is it possible to reverse those roles where one is more like with mom, you could be more the daughter rather than like the authority, or the caregiver, and with your sister more of the authority rather than just like, the sister? Or are those roles more or less ingrained and that's the most effective way to do it? And the reason I ask that, before you answer, so many of the families, that we help, one of their biggest concerns, and I don't want to say complaint, but one of the biggest realities for them is they say, I'm just so exhausted because I want to have that relationship with my mom as a mother-daughter relationship rather than a caregiver to, caree relationship. Is it possible to have it both ways?
it is. Yeah, it is. But as the care giving situation continues, I think it's less able to, because it takes such a strain on both. The care recipient starts to decline, and their emotions also start to change, and then the care provider becomes more strained and their relationship changes as well. So there is a change that goes on with time. So initially, as with anything, I don't want to really say a honeymoon period, but there kind of is, okay, I'm going to do it, I'm happy to do it, and you got the energy to do it, both emotionally and physically. But then as time goes on, the way you felt the first 2 months is not the way you felt 2 years later.
Yeah, that's a great point. Before we close here, Vicky, I just want to leave you and our viewers and listeners with one last question. What is one piece of advice to somebody that might just be now starting out on this caregiving journey with a loved one that you think is the number one thing they need to know going into it?
There are resources out there for you, and utilize them.
Yeah.
Utilize them.
That's wonderful. Well, Vicky Castillo, thank you so much for sharing your journal entry with us here at the Caregivers Journal podcast. Cindy and Christina Hardin-Weiss, ladies, always a pleasure and a joy to see you too. Just want to wish you both a great week and a great 2025 ahead.
Sounds great.
Thanks, Lance.
Thank you so much, Lance. I appreciate it. Thank you for taking the time to listen to my story. Cindy and Christina, you are the best. You're such dear friends to me, and I appreciate you so much.
Wonderful. All right, now we're going to play our caregiver tip of the month.
Today I'm going to let you in on a little therapy secret. You ever wonder why a therapist recommends one walker over another? Let's start with the standard walker. So as you can see here, this has 4 legs, no wheels. Why would I recommend this for somebody? If they have an injury or a problem with one of their legs versus the other, this might be a walker that I recommend to them because they may be non-weight bearing. So maybe they can't bear weight on one leg. This is going to be a stable walker that you can put forward and really put some good pressure down through as you advance your good leg. So that's what I would use a standard walker for. Front-wheeled walker or two-wheeled walker. I might use this in a scenario where someone is recovering and maybe they had increased weight bearing. Maybe they are what we call weight bearing is tolerated, which means they can put as much weight on that leg as they want to or feel comfortable doing. So with that, this is going to start getting them closer to working on a more normal gait pattern or walking pattern. So that's why I would recommend something like this. I might also recommend this for someone who has some trouble with stability, maybe is weak, needs some pretty good stabilization, just for working on that normal walking pattern. All right, a rollator or a four-wheeled walker, who would I recommend this for? So if I've got somebody that is pretty good on their feet but maybe has some balance issues, needs something for stability, but is pretty active, maybe goes out quite a bit, this is what I would recommend for them. They're going to be able to handle this better. The caster wheels on the front is going to give them a little bit more flexibility in the maneuverability of this walker. This is not one that they're going to bear a lot of weight on. This is used more for just stability, balance, maybe transporting things like food or groceries or things like that.